Introduction. In Rational Emotive Behavior Therapy, REBT, goals are not only essential for structuring treatment, but also for guiding clients toward lasting psychological and behavioral change. Effective goal setting in REBT requires more than identifying what a client wants to stop feeling or stop doing. Instead, goals should be structured to reflect the theory's emphasis on emotional responsibility, realistic expectations, and behavioral accountability. This lecture outlines the essential components of effective REBT goals and provides practical strategies for clinicians, both novice and experienced, to implement with clients in therapy. 1. Shift from dysfunctional to functional negative emotions. One of the core aims of REBT is to help clients shift from experiencing dysfunctional negative emotions, such as anxiety, depression, rage, guilt, or shame, to functional negative emotions, such as concern, sadness, annoyance, righteous indignation, remorse, or disappointment. Crucially, goals should not aim to replace a dysfunctional emotion with a positive one in the face of a genuinely difficult or adverse activating event. It is unreasonable to expect happiness or calmness. Instead, the goal is to help clients respond with appropriate, tolerable, and helpful emotional reactions that promote problem solving and resilience. Example, instead of, I want to stop feeling anxious about my job interview, try, I want to feel concerned so I can prepare well and perform to the best of my ability. 2. Replace rather than reduce. Dysfunctional emotions. Clinicians should avoid framing emotional goals around the reduction of dysfunctional emotions. Lowering the intensity of an irrational emotion like rage or guilt still leaves the client with a maladaptive emotional response. The REBT approach involves replacing the dysfunctional emotion with a functionally adaptive alternative. Example, instead of, I want to feel less guilty about my past behavior, try, I want to feel remorse that motivates me to make amends and change future behavior. This shift encourages clients to engage in self-reflection and action without becoming paralyzed by unhealthy emotional responses. 3. Use approach goals, not avoidance goals. Avoidance goals such as, I want to avoid anxiety, I want to stop relapsing, or I don't want to get angry, tend to be vague and difficult to operationalize. Furthermore, they often backfire as they focus the client's attention on what they are trying to escape, which can increase anxiety and self-monitoring. REBT emphasizes approach-oriented goals, which focus on what the client will do, rather than what they want to avoid. Example, instead of, I want to avoid social situations that trigger anxiety, try, I want to initiate a brief conversation with a new person once a week. Approach goals provide a clear target and reduce the cognitive burden of trying to avoid a wide range of possible triggers. 4th, promote collaborative, socially connected goal attainment. Effective REBT goal setting should take into account the role of social connection in emotional regulation and motivation. Clients often believe they must face challenges alone, a belief that can reinforce isolation, shame, and avoidance. Instead, clinicians should guide clients to set collaborative goals where they seek support or pursue goals with others. Research shows that working toward goals in tandem with others can increase accountability, reduce perceived difficulty, and boost the release of oxytocin, a hormone linked to trust and emotional bonding. Example, instead of, I have to manage my anger on my own, try, I will practice my anger management skills with my partner during a weekly check-in. This shift promotes both accountability and belonging, important components of long-term emotional health. 5. Set realistic and attainable goals. EBT encourages clients to hold rational expectations. Therefore, goals must be attainable, considering the client's current resources, support systems, time, and energy. Unrealistic or overly ambitious goals set clients up for disappointment and reinforce irrational beliefs such as, I must succeed right away, or I'm a failure. Clinicians should guide clients to identify what is doable within a realistic time frame and to celebrate incremental progress. Example, instead of, I will eliminate all panic attacks within the next 2 weeks, try, I will use diaphragmatic breathing each time I notice early signs of a panic attack. The key is to ensure measurable progress without setting up for self-sabotage. 6. Define clear behavioral goals. A goal that cannot be seen, measured, or described in behavioral terms is difficult to evaluate or adjust. REBT goals should be clearly defined in ways that allow both therapist and client to track progress. Example, instead of, I want to have more self-esteem, try, I will write down 3 examples of what I did well each evening before bed. Behavioral goals also help anchor the therapy process in observable change, which supports accountability and allows for reinforcement of progress. Conclusion, goal setting within REBT must reflect the model's emphasis on rational thinking, emotional responsibility, and behavioral accountability. The most effective therapeutic goals are those that promote a shift from dysfunctional to functional negative emotions, focus on replacement rather than reduction of irrational emotional states, emphasize approach, behaviors over avoidance, involve collaboration and social support, are realistically achievable within a given context, are behaviorally specific and measurable. Helping clients set these kinds of goals enhances not only emotional regulation and cognitive clarity, but also fosters sustainable behavior change and improved relationships. Suggested practice, exercise for students and clinicians. Case scenario, a client says, I want to stop being so anxious at work. I just want to feel normal. Task, reframe this as a functional emotional goal. Transform the goal into an approach-oriented behavioral goal. Consider how collaboration or social support might be integrated. Example, answer, I want to feel concerned, not anxious, so I can focus on doing my tasks well. I will use a 3-minute grounding technique when I notice myself getting overwhelmed. I will check in weekly with my supervisor to get feedback and reassurance.